Hello there. It is my pleasure to provide you with some practical information to help your recovery from your emergency surgical procedure. All information presented is recommended and supported by a critical review of the medical literature. Together, we'll explore the best way to become involved in your recovery. Following surgery, you might experience some pain. The sensitivity to pain is different for each person. If you had a laparoscopic surgery, there is a chance you may feel some pain around your shoulder. This pain is from the carbon dioxide gas that is used to expand your abdomen during this type of surgery and will resolve quickly. Your throat may also feel sore from the tube used to help you breathe during surgery. If your mouth feels dry, you may have some ice chips and drink plenty of fluids, which will help with the sore throat. If you had a spinal anesthesia, some patients may develop a headache, backache, or leg pain. These symptoms are not dangerous and will gradually disappear. If any of these symptoms last more than 24 hours or are getting worse, please call the perioperative unit and let the nurse know at 514-340-8222, extension 22432. It is normal to have some pain around your surgical site during the first weeks following surgery. Take the medications as prescribed for you by your doctor. These usually include pain medications like acetaminophen or Tylenol, and anti-inflammatories such as ibuprofen or Advil, and a narcotic like oxycodone, Dilaudid, or morphine. Narcotics can have side effects like nausea, dizziness, and constipation, so only add them if the other medications are not sufficient to ease your pain. You can also use cold packs applied to the wound as needed. Do not leave a cold pack on for longer than 15 minutes at a time, and do not apply it directly to the skin. To avoid constipation, be sure to drink lots of fluid and eat fiber-rich foods such as fruits and vegetables. You may also be prescribed a laxative such as Laxaday or Metamucil. If you have severe pain in the abdomen or chest, fevers of 38.5 degrees Celsius or above, shortness of breath, or non-improving nausea and vomiting, you should immediately contact a healthcare provider or present yourself to the emergency room. Your wound. If you have a bandage, you may remove it 24 hours after the operation, after your shower. You should avoid having a bath for 3 days after your surgery, and only do so if your incision is closed and dry. Your incisions may be closed with stitches that dissolve by themselves. You may also have tape strips over the incisions called steri-strips. When the ends of the steri-strips start to curl, just remove them gently. If they haven't fallen off within a week, you may peel them off yourself. Leave your incisions open to air. If your incision is closed with surgical clips, they will need to be taken out at the doctor's office or the CLSC about 10 to 14 days after the operation. You may feel a bump along the incision, which is sometimes numb or sensitive. This is expected and will return to its normal feeling after a few weeks. Some bruising and swelling is also normal. Do not be concerned. This will disappear with time. Avoid constrictive clothing or clothing that rubs against your incisions like tight belts or rough jeans. Please contact a healthcare provider if your wounds become red, inflamed, painful, swollen, or start to discharge fluid. Drains. If you have a drain, your nurse will explain to you how to empty it and care for it at home. The CLSC nurse may be involved in the care of your drain in some cases. The drain remains in place until your surgeon advises to remove it, on average 1 to 2 weeks. It is important to write down how much fluid is coming out of the drain each day and bring the list to your follow-up appointment. It is not normal to have redness or more than mild tenderness around the drain or surgical incision, or to have fluid leaking around the drain or from the incision. If any of these are happening at home, please contact your surgeon. Diet. There are no restrictions on your diet, but a balanced, varied diet is recommended. Be sure to drink lots of fluid and eat fiber-rich foods like fruits and vegetables to avoid constipation. If you are on a special diet before your surgery, such as for diabetes, start back on it. If you drink alcohol, you may want to restrain your alcohol consumption for a few weeks while you're taking pain medication, which can reduce post-operative complication rates. Activity. You can go out for walks, go for a ride in a car, and can climb stairs. You can gradually increase your activity every day as tolerated, but do not overtire yourself. Remember to walk standing straight. Do not lift anything greater than 10 to 15 pounds or 5 to 7 kilos for 2 weeks after your surgery or for as long as your doctor recommends to you. You may drive when you're comfortable and are not taking any medication that would interfere with your ability to react appropriately in the event of an emergency on the road. You can resume your sexual activity as desired. Lastly, undergoing emergency surgery can be very stressful. Please take this opportunity to rest and recover, and perhaps consider making some new healthy choices. If you smoke, you would benefit from stopping because smoking can cause problems with your breathing and recovery. We can assist by referring you to one of our effective hospital programs. In closing, contact your doctor's office in the next few days to make a follow-up appointment for 3 to 4 weeks after your surgery. To enhance your recovery, you will benefit to return gradually to normal as quickly as possible. This means that you need to actively participate in your recovery by walking, eating, and drinking. Each day, you should feel some improvement, but do ask your healthcare provider if you're worried about something. It is our hope that this video makes you feel more confident about what's ahead. On behalf of the pre-care team, we wish you the best on your journey.